What is a blood gas test? A blood gas test is also called an arterial blood gas test or a blood gas analysis. It measures oxygen and carbon dioxide levels in the blood. The test can also show blood potential of hydrogen levels and lung function. Doctors often use blood gas test in emergency situations to help diagnose the cause of breathing difficulty. In this video, learn more about the purpose of a blood gas test and how to interpret the results. Purpose: anyone who is struggling to breathe or who has a lung-related health issue will undergo a blood gas test. The results can help a doctor to identify the cause of symptoms. A blood gas test can show how well the lungs, heart and kidneys are working. More specifically, results of the test can help a doctor to diagnose lung and breathing problems, check whether treatments for lung conditions are working, determine whether a person has a ruptured blood vessel, metabolic disease or chemical poisoning. Doctors also use the test to check the acid-base balances in people who have kidney problems, have diabetes, are recovering from drug overdoses. And additional testing. A doctor will not use a blood gas test alone to make a diagnosis. They usually need other tests, including urine test to check the functioning of the kidneys, a chest X-ray or other imaging to examine the lungs, tests that measure lung volume. The doctor will also request further blood work to determine a person's blood counts and to check the levels of sodium, potassium, bicarbonate, blood glucose, commonly known as blood sugar. Understanding the results. Abnormal results of a blood gas test can indicate that health conditions or injuries are affecting a person's breathing. When making a diagnosis, a doctor will consider results of this test and others and a person's overall health. The results of a blood gas test can show whether the lungs are getting enough oxygen, the lungs are releasing enough carbon dioxide, the kidneys are working properly. The following are normal ranges for results of a blood gas test. Potential of hydrogen or pH 7.35 to 7.45. Partial pressure of oxygen or PaO2 80 to 100 millimeters of mercury. Partial pressure of carbon dioxide 35 to 45 millimeters of mercury. Bicarbonate 22 to 26 milliequivalents per liter. Oxygen saturation 95%. Age, health, history and sex can influence these measurements. Results that fall outside the normal ranges do not always indicate a heart, lung or kidney problem. A doctor is in the best position to explain to each person what their results mean. Potential of hydrogen, pH and partial pressure of oxygen or PaO2. The two most important measurements are potential of hydrogen, also called the acid-base balance, and partial pressure of oxygen or PaO2. If a person's potential of hydrogen is out of balance, it could mean that their lungs are not functioning well or that their kidneys are struggling to remove waste. If potential of hydrogen results fall outside of normal ranges, the doctor will perform further tests to determine the reason. The partial pressure of oxygen measurement shows the oxygen pressure in the blood. Most healthy adults have a partial pressure of oxygen within the normal range of 80 to 100 millimeters of mercury. If a partial pressure of oxygen level is lower than 80 millimeters of mercury, it means that a person is not getting enough oxygen. A low partial pressure of oxygen level can point to an underlying health condition such as emphysema, chronic obstructive pulmonary disease or COPD, pulmonary fibrosis, a problem with the heart. A doctor usually performs a blood gas test in a hospital when a person has a severe illness or injury. The doctor will draw blood from an artery in the wrist to check how well the lungs and kidneys are functioning. Results of a blood gas test can help to determine the cause of breathing problems. However, a doctor will also consider results of other tests before making a diagnosis.